Welcome to the Dr. William Lee podcast. I'm Dr. Thomas, and joining me today is physician and medical researcher Dr. William Lee. In this episode, we're taking a closer look at something many people over 60 use almost daily: turmeric.
Thanks, Thomas. Turmeric has earned a powerful reputation over the years. It's praised for reducing inflammation, supporting digestion, easing joint discomfort, and even protecting the brain. For many older adults, it feels like a natural and harmless way to support long-term health.
And that's exactly why this conversation matters. Because while turmeric does have real benefits, it's often treated as something that can be taken anytime, in any amount, and with anything else on your plate. That assumption can be risky, especially after the age of 60. As we get older, the body processes foods and supplements differently. Liver function slows, kidney clearance changes, and many people begin taking medications on a daily basis. In that context, turmeric stops being just a spice and starts behaving more like a biologically active compound, one that can interact with what you eat and what you take.
Most people never hear about the downsides. They hear anti-inflammatory and assume more is better. But certain combinations can reduce turmeric's benefits, interfere with medications, or even create health problems that develop quietly over time. That's why today's episode has a very specific goal. We're going to walk you through 3 categories you should never combine with turmeric after 60, not based on internet myths, but on what medical research and clinical experience actually show.
This isn't about fear, it's about using a powerful natural tool the right way. And before we continue, make sure you subscribe to the Dr. William Lee podcast. We regularly share practical, evidence-based insights that help you make safer decisions about food, supplements, and long-term health. Now let's take a closer look at why turmeric is helpful and why it also deserves respect. When people think of turmeric, they usually picture a golden spice that helps with everything from joint pain to memory. But the real star inside turmeric is curcumin, a compound with serious biological activity. It's been shown to lower inflammation, neutralize free radicals, support liver health, and even protect neurons in the brain.
What's less commonly known is that curcumin is extremely sensitive to the environment it enters. On its own, the body barely absorbs it. Without the right support from other compounds or foods, it gets metabolized too quickly to deliver its promised benefits. That's why scientists refer to it as having low bioavailability, and this is where the story becomes more complex. Just like medications, curcumin's effectiveness depends heavily on the context in which it's consumed. Some combinations dramatically enhance its absorption, while others can suppress or even reverse its positive effects. The digestive system of a 65-year-old doesn't respond the same way as that of a 30-year-old.
Absolutely. Age introduces several metabolic shifts: slower liver detoxification, reduced stomach acid, and changes in how nutrients interact with medications. This makes the body more vulnerable to adverse reactions, even from something as natural as turmeric. A well-intended habit like drinking turmeric tea every morning could become counterproductive, depending on what else is in your system. A compelling example appeared in the Journal of Nutritional Biochemistry in 2023. Researchers observed that when older rodents were fed curcumin under acidic conditions, they developed ulcers and gastrointestinal lining damage. The takeaway wasn't that turmeric is harmful. It was that curcumin's activity is highly dependent on digestive environment.
And it doesn't stop there. Because curcumin is fat-soluble, it requires dietary fat to be absorbed effectively. But not all fats are created equal. When paired with saturated fats like those found in heavy cream or full-fat cheese, curcumin's anti-inflammatory function can be neutralized, or worse, reversed. That's a critical detail for older adults. Many believe that more turmeric means better results. They add it to smoothies, soups, pills, sometimes all in the same day. But overloading on curcumin, especially if it's paired poorly, can silently stress the liver or interfere with medications. It's not about quantity, it's about precision.
Turmeric is often lumped into the harmless supplement category, but curcumin has pharmacological effects. It interacts with enzymes in the liver, affects blood clotting, and can even alter blood sugar regulation. That makes it both powerful and potentially risky, depending on how and when it's used. In clinical practice, we've seen patients who unknowingly sabotage their health because they combined turmeric with foods or medicines that weren't compatible. They had the right intentions, but the wrong pairing.
This isn't a reason to fear turmeric. It's a reason to treat it with the same respect you'd give any active compound. Used wisely, it's an ally. Used carelessly, it can be disruptive, especially as the body ages. Moving forward, we'll break down 3 specific scenarios where turmeric's helpful nature can be compromised. Understanding these will help you get the most out of what turmeric truly offers, without risking hidden harm. One of the most overlooked risks when using turmeric in older adults revolves around its interaction with prescription medication, especially blood thinners. For those over 60, drugs like warfarin, apixaban, or even low-dose aspirin are often part of daily life. These medications are critical for preventing strokes, clots, or heart attacks, but they come with their own balancing act.
And turmeric can quietly tip that balance. Curcumin, the active compound in turmeric, is widely known for its anti-inflammatory effects, but not everyone realizes it also has mild anticoagulant properties. While that may sound like a benefit, it becomes dangerous when combined with prescription anticoagulants. The effects don't just add up, they can multiply. That was highlighted in a large-scale observational study published in JAMA Internal Medicine in 2023. Researchers followed over 2,000 individuals aged 65 and older who were taking warfarin. About one-third of them also reported taking turmeric supplements, either curcumin capsules or daily turmeric beverages. The results were sobering. Those who regularly consumed turmeric had a 21% higher rate of gastrointestinal bleeding over 6 months compared to those who didn't.
That increase wasn't due to overdosing or extreme use. The most common dosage was around 500 1,000 mg of curcumin extract per day, which falls within typical supplement guidelines. The real issue was the interaction effect, which intensified the blood-thinning action of warfarin. People think of turmeric as food, not medicine, which leads to a false sense of safety. But for the body, turmeric doesn't get a free pass. It still goes through the liver, interacts with enzymes, and modulates clotting factors, just like pharmaceutical drugs do.
The bleeding risk becomes even more pronounced when turmeric is consumed with other natural anticoagulants like ginger, garlic, or ginkgo biloba. It's a common combination in detox teas or immune-boosting smoothies. But for someone on warfarin or apixaban, that mix could be setting the stage for internal bleeding, bruising, or even brain hemorrhages in rare cases. What makes it more difficult to catch is that the symptoms often appear gradually. A bruise here, dark stools there, maybe some fatigue, and many older patients attribute it to age or forget to mention the turmeric supplement they're taking.
That's why healthcare providers often emphasize INR monitoring, a measure of how long blood takes to clot. But few people know that even modest daily turmeric intake can throw off INR levels, especially in frail or underweight seniors. And to be clear, this caution doesn't apply to everyone. In healthy individuals not on medication, turmeric is generally safe when used in food. But once multiple variables enter the picture, age, medication, dosage, frequency, turmeric must be treated with medical respect. The best step for anyone on blood thinners is to consult their physician before taking any form of turmeric supplement. Even culinary turmeric, if used in large amounts daily, should be mentioned to a doctor, especially if bleeding symptoms appear.
This isn't fear-mongering. It's about understanding that natural remedies still act on the body's systems. They have power. And when that power interacts with prescription medicine, the outcome can either support healing or trigger serious complications. In the case of blood thinners, turmeric's role must be handled with precision, not avoided altogether, but definitely not treated casually. When people talk about turmeric, they often highlight its ability to lower blood sugar levels. That's true, but the real question is, lower by how much and in what context? For individuals over 60 who are already on diabetes medication, the effects of turmeric can be dangerously underestimated.
Exactly. Curcumin, the active compound in turmeric, has been shown in multiple studies to enhance insulin sensitivity and reduce glucose levels. That's fantastic news until it overlaps with medications like metformin, glibenclamide, or insulin injections. When taken together, these combinations can trigger hypoglycemia far faster than expected. In fact, a 2023 study published in Diabetes Research and Clinical Practice tracked 108 elderly patients taking metformin who also consumed turmeric capsules daily. Within 3 weeks, 26% of them reported symptoms of dizziness, fatigue, blurred vision, and confusion, classic signs of low blood sugar. Blood tests confirmed that glucose levels had dropped below 70 mg/dL in nearly all symptomatic cases.
We're not just talking about minor side effects. Hypoglycemia in older adults can lead to falls, cognitive confusion, fainting, and in some cases, hospitalization. What makes this more alarming is that these patients thought they were being proactive, taking something natural, something healthy. It's important to emphasize, turmeric is not the enemy. The problem lies in the assumption that natural equals safe in all contexts. As we age, our metabolism slows, our liver clears compounds less efficiently, and our body becomes more sensitive to drug interactions. I've seen patients who added turmeric tea to their daily morning routine while still on medication, without adjusting their dosage or informing their physician. They started feeling lethargic by noon, sometimes mistaking the symptoms for fatigue, dehydration, or even early dementia signs. But the root cause was unstable blood sugar.
And it's not just the tea or the spice in cooking. Many turmeric supplements contain concentrated curcumin, some even enhanced with black pepper extract, piperine, which dramatically increases absorption. That intensifies the hypoglycemic effect when combined with anti-diabetic drugs. So what should people do instead? First, if you're over 60 and managing blood sugar with medication, do not start turmeric supplements without medical supervision. Second, keep a glucose log if you're experimenting with any new supplement, especially something as potent as curcumin. Third, remember that timing matters. Taking turmeric too close to your medication could spike its effect unpredictably.
We recommend working with a healthcare provider to assess your full medication and supplement routine. If you want to include turmeric for its anti-inflammatory benefits, it may be safer to use it in small dietary amounts, like cooking with it, rather than concentrated capsules, and always watch for warning signs: shakiness, sweating, mental fog, or mood swings. These can be early symptoms of blood sugar dipping too low. Don't brush them off.
Turmeric is powerful, but power without awareness can turn a remedy into a risk, especially in the context of aging. Every compound, natural or pharmaceutical, has to be evaluated for its full systemic impact. That's the key takeaway. Integration, not isolation. Don't treat turmeric like a miracle cure. Treat it like a tool and use it wisely with full understanding of how it fits into your unique health profile.
Many older adults take iron supplements to address anemia, fatigue, or age-related nutritional deficiencies. At the same time, turmeric has become a go-to anti-inflammatory choice in their daily regimen. But what happens when these two are consumed together? Most don't realize that turmeric, while beneficial in many ways, can significantly inhibit iron absorption.
That's right. Curcumin, the active compound in turmeric, has chelating properties. This means it binds to metal ions like iron and forms complexes that the body can't easily absorb. While this may be helpful in conditions involving excess iron, it becomes problematic for those trying to increase their iron levels through supplements or diet. A study from the European Journal of Clinical Nutrition in 2022 investigated this very issue. It showed that taking turmeric alongside ferrous sulfate, one of the most common forms of iron supplements, reduced non-heme iron absorption by nearly 40% in older adults. These results weren't theoretical. Participants in the study who combined turmeric with their iron pills reported stagnant or even declining iron levels over a 6-week period.
For someone already borderline anemic, that's a big deal. Iron deficiency anemia isn't just about feeling tired. It affects oxygen transport, cognitive clarity, and immune function. When the body can't get enough usable iron, it compromises everything from cellular energy production to muscle recovery. And the issue isn't limited to supplements. Even iron-rich meals like red meat, beans, or fortified cereals can have their benefits neutralized if turmeric is consumed at the same time. This is particularly relevant for elderly individuals relying on every meal to deliver critical micronutrients.
I've had patients ask, but I thought turmeric improves digestion? That's partially true. It stimulates bile and can help with mild bloating. But that doesn't mean it's universally beneficial when taken with all nutrients. In this case, curcumin competes with iron for transport pathways and chemically blocks its bioavailability. So what should someone over 60 do if they need both iron and turmeric? The answer lies in timing and separation. You can still benefit from both, but they shouldn't be taken together. Allow at least 2 to 3 hours between your turmeric supplement or golden milk and any iron supplement or iron-rich meal.
Also, be aware of hidden combinations. Some superfood powders or turmeric lattes may contain both turmeric and added minerals like iron or calcium. These products are marketed as all-in-one solutions, but may be sabotaging your nutrient intake without you realizing it. This is why personalized nutrition matters. For aging adults, especially those managing anemia, every interaction counts. You might think you're doing everything right, eating spinach, taking your iron pills, drinking turmeric tea, but if the timing is wrong, the results will disappoint you.
A simple rule of thumb: treat turmeric like a medication. Respect its power, plan around it, and always review your supplement schedule with a healthcare provider. By creating strategic gaps between turmeric and iron, you allow each to do its job effectively, without undermining the other. That kind of small adjustment can have a large impact on long-term energy, immunity, and mental clarity.
We've seen it over and over again. Older adults who hear that turmeric is good for inflammation, and suddenly it becomes a daily ritual. Turmeric in the morning smoothie, turmeric in tea before bed, capsules after every meal. There's this unspoken belief, if a little helps, a lot must be better. It's the classic more is better trap. And I get it. People want control over their health. They want something natural. When they find out turmeric is anti-inflammatory, improves brain health, and helps the joints, it's like striking gold. But there's a difference between therapeutic use and blind consumption.
This mindset is especially strong among seniors. They've lived through decades of pill bottles, shifting dietary advice, and medical uncertainties. When they discover a superfood that's ancient, plant-based, and non-pharmaceutical, it feels trustworthy. But that emotional trust often overrides logical caution. And the irony is this: turmeric itself isn't the problem. It's not toxic in normal amounts. But when it's layered into everything, capsules, drinks, soups, supplements, without any thought to how it interacts with other medications or nutrients, that's when issues arise. Turmeric becomes a background noise they forget to count.
What's missing is context. No one tells them turmeric might interfere with their blood thinners or block iron absorption or clash with meals. They hear natural and assume harmless. And to be fair, it's not their fault. Most product labels don't explain the nuances. Friends recommend it like a miracle spice, and that's enough to convince them. What I'd like people to remember is this. Food is powerful, but power must be managed. You wouldn't double your medication dose just because it works, yet people double their turmeric intake thinking they're being proactive. That same turmeric could be undermining their other treatments or causing silent effects they won't notice for months.
There's wisdom in simplicity. Using turmeric thoughtfully, 1 dose a day, with the right meal at the right time, can be incredibly beneficial. But when used without awareness, even something healing can become a hidden risk. So no, turmeric isn't a magic bullet. It's a tool, and like any tool, it needs a skilled hand, not just enthusiasm.
To wrap up, it's clear that while turmeric offers impressive benefits, particularly for those over 60, its effectiveness depends heavily on how it's used. Paired with the wrong substances, it can lose its therapeutic impact or even lead to harmful effects.
We highlighted 3 key categories of risk. First, blood-thinning medications. Turmeric can amplify their effects, increasing the risk of internal bleeding. Second, diabetes drugs. Combining turmeric with glucose-lowering medications may drive blood sugar down too far, especially in older adults. And third, iron supplements. Turmeric can block iron absorption, which is already a concern for many seniors dealing with fatigue or anemia. And it doesn't stop there. As we discussed, the mindset of more is better often drives people to overuse turmeric without considering timing, dosage, or food interactions. In doing so, they may be compromising their health rather than improving it.
Our goal today wasn't to scare anyone away from turmeric, but to help you use it wisely. Think of it as a precision tool, not a blanket solution. If you're currently taking medications or supplements, talk with your doctor before adding high doses of turmeric or curcumin capsules to your routine. And if you found this information valuable, share it with loved ones, especially older family members who may be unknowingly making these mistakes. For more science-backed insights like this, make sure to like this episode, drop a comment with your thoughts, and subscribe to the Dr. William Li podcast. We're here to help you make smarter health choices, one step at a time.
Thank you for listening, and we'll see you in the next episode.